So, I've been talking about the rollback of COVID protections as if people follow them, as if there was any enforcement. Reminder, if there's no enforcement mechanism for an order of like an emergency order or a mandate or a law, if there's no enforcement mechanism, then there is no law, there is no order, it's made up. Now, again, we are about to roll into winter in a lot of these states. New York is posting this weird genocidal campaign talking about wearing masks is just as good as not wearing masks, as if that's a real thing. Anti-science Looney Tunes, right? And I want to turn my attention over to Washington because, again, any reason to shit all over these Democratic governors, I'm going to take. Inslee announces end to Washington's COVID emergency orders. Now, again, it's one of those things here that really is, it's like, I'm going to read this, and I'm going to point out, like, why this is so hilarious to me. But, the remaining COVID-19 emergency orders are finally set to expire. Governor Jay Inslee announced Thursday he is ending the orders and state of emergency by October 31. There were 85 total COVID-19 emergency orders Inslee had put in place since the pandemic started. Most are already lifted. There are 13 healthcare-related orders, which will end October 27. The rest, 10 of them, will be lifted October 31. But what does Inslee have to say about this? We've come a long way in the past 2 years in developing the tools to allow us to adapt and live with COVID-19. Now, who is us in this instance? Who is Jay Inslee talking about? Well, Jay Inslee is talking about people that aren't immunocompromised. Jay Inslee is talking about people that are not disabled. Jay Inslee is talking about people that are not obese. Jay Inslee is talking about people that are not overweight. But wait a second. 93% of this country has a form of metabolic syndrome. 70% of this country is overweight. 45% of this country is obese, right? So who is us in this instance? Think about it. To adapt us and live with COVID-19, Inslee said. Ending this order does not mean we take it less seriously or we'll lose focus on how the virus has changed the way we live. Actually, I'm willing to argue that ending the order is exactly correlating to meaning you don't take it seriously. Now, again, I'm willing to also argue that they never took it seriously to begin with, right? And I can provide any amount of evidence for that case. But, like, at least the order existing, no enforcement mechanism, right? There's really no way to do anything about it. At least the order being on the books is, like, ending the order objectively by every metric of every possible combination of words in the English language means you are taking it less seriously. That is, like, I don't know. Like, so we're stopping all precautions, but we're taking it just as seriously. What? Now imagine someone from the FDA says, all right, we're going to slash regulation. We're going to slash health standards and service standards for meat processing, right? But it doesn't mean we take it any less seriously. It's just that we're going to lower all, like, we're going to increase the threshold of acceptable feces in meat. We are going to reduce the quality of the meat that's required, but we're not taking it any less seriously. You know, the quality of your meat should stay the same, but we are reducing the standards of quality, but we're not taking it less seriously. What? We will continue our commitments to the public's well-being. No. And first of all, continue implies that you did anything to begin with. So you have to start something in order to continue it. That would be like if I said, and I'm going to continue my routine of flipping goddamn coins, right? That's what I'm going to do. I'm just going to continue this routine of flipping the goddamn coins. Well, I have to start it before I continue it, right? So if you never started doing something, how do you fucking continue it, right? So anyway, to the public's well-being, but simply through different tools that are now more appropriate for the era we've entered. What tools? I don't know. How are you going to use those tools? No idea. But we got tools. Trust me, bro. You don't know what they are. I don't even know what they are. But we got some tools. Quote, Governor Inslee's, however, though Inslee is ending the emergency orders, he and public health leaders want to remind people masks and vaccines will keep communities safe. Quote, Governor Inslee's rescission of these remaining emergency orders marks an important transition for the state of Washington, but that does not mean that COVID-19 is not in our state anymore. Like, so what's the transition? Quote, we must move forward from the pandemic response to adapting our behaviors to coexist with the COVID-19 virus. Now, again, I'm willing, right? I am willing to acknowledge that that is possible, right? Like, if everyone were to wear masks, N95 rated masks, and the government were to give everyone N95 rated masks, and everyone complied through the goodness of their own hearts, okay. That's learning to live with the pandemic. But we're not doing that. Like, mask rating, like like I go to the grocery store and literally hundreds of people in the grocery store, 5 or 6 are wearing masks. So what is this learning to live with it other than forcing everyone to get sick and forcing immunocompromised people to die and forcing elderly people to die? Other than that, what is learning to live with the virus? What is coexisting with the virus? Though the continued diligence of Washingtonians combined with access to resources like the Say Yes COVID test program, WA Notify, and Caravan, we will continue our path to recovery. I don't know much about those programs in specific. I don't live in Washington. There are some things staying, such as statewide face covering order by the State Department of Health. Now again, an order without an enforcement mechanism is not an order. It's a suggestion. It's a suggestion. There is no enforcement mechanism. If no one is going to stop you from going into an indoor facility without wearing a mask, then wearing a mask is not required. Like, I remember when the pandemic was first starting, I was living in North Carolina, and the grocery stores would all have, like, you know, you must wear a mask to enter the store, right? And I would see people with no mask go to the store, walk in, right? The greeter would say hi, and the greeter would have, like, their nose poking out, of course, right in front of a sign that says you must wear a face covering to enter the store. If there's no enforcement mechanism, if private companies aren't going to enforce this, if the government is not going to enforce this, if law enforcement is not going to enforce the law, then guess what? It's not an order, it's not a law, it's not a mandate. It's just someone saying words and then you ignoring them. Vaccine requirements for healthcare workers and education workers is also over. This one is just insane to me. This one is insane to me. Though employers can still require them if they choose. The requirement will remain for most Washington state agencies. The idea that you would want to be involved in a healthcare facility where people made their choice, quote unquote, to not get the vaccine. What? 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 Haven't people gotten, like, attacked for trying to enforce it, though? I'm not getting attacked for Walmart. I want to tell this story because that reminds me, when the pandemic first started, I lived in North Carolina, and the governor had a mask mandate. And in the governor's, like, announcement or whatever, you know, if like, so the mask mandate was, like, if a company does not comply, they're going to get fined by the government. So what I would do is I was a concern troll. I would go to every store, and if the employees were not wearing masks, I would report them to whatever agency that was and try to get them fined. And I remember I had a really interesting argument with the manager of Walmart, whom introduced himself as Rick to me. So hello, Rick. And he started, like, getting really, like, angry at me for saying, like, yeah, actually there's a mandate, and if you don't follow this, I'm going to report your store, and you're probably going to lose your manager position because you're costing the corporation money. And this guy got super fucking mad with me and was like, I'm not going to do anything. I don't believe in the Democrat agenda or whatever, you know? And it's like, you know, you got to take this up with the Democrat governor. I don't believe in these goddamn liberals. And it's like, so anyway, needless to say, Rick was no longer the manager there as of a couple years later. At least I never saw him there, and I saw other people that were managers. And I remember one time I asked someone, like, oh, how's Rick going? Like, you know, just, and they're like, oh, Rick doesn't work here anymore. So anyway, so shout outs to Rick. Rick the prick, everybody. Anyway, I just, again, like, our world is insane. Like, our world is insane. Like, you need to understand no one is going to help you. Right? No official agency has your well-being in mind. They all want to manipulate you as part of their scientific medical experiments. Right? They want to manipulate you into giving them votes and giving them money at your expense. And that's it. And both parties, in this instance, on this subject, when it comes to public health, Democrats and Republicans, both, are the parties of pro-genocide. They are in favor of eugenics. They are in favor of medical experiments. That I don't consent to this medical experiment. I don't consent to being experimented on. I don't. But what choice do I have? I can't leave the house without participating in a medical experiment against my will. So, again, it's crazy. It really is. And then again, imagine it, like, I'm not immunocompromised. I could get COVID. I'll probably be fine. But I don't want to deal with long COVID. 30%? Fuck that shit. 30% chance you're going to get long COVID according to studies. I'm not taking that chance. Fuck that shit. But I know I'm not going to die if I get COVID. But imagine how people feel if knowing that if they did get COVID, they're probably going to die. Or they're probably going to face some severe permanent injury. That's some crazy fucking shit. That's crazy shit. That's crazy. And again, it's the feedback loop. Stupid fucking politicians elected by stupid fucking people, right? And it's the feedback loop. Dumb motherfuckers vote for dumb motherfuckers that take advantage of the dumb motherfuckers so that they can get voted for by more dumb motherfuckers. And it's going to go in this circle until someone breaks the loop. Max, you smell like dog. Look at this. Max, why do you smell like dog? Why do you smell like dog? Anyway, that's all I have to say on that subject. Wear a mask, you fucking idiot.